Hello, everyone. Welcome. It's Hump Day. Today is Wednesday, June 29th, 2022. I am Salad Blue Sister, and this is My Turn to Talk. Welcome, Grid. You are number one today, a quick number one. Welcome, welcome. Welcome, Ninja Bunny. Welcome, welcome. You are number two. Number two. Yeah, baby. Number one. Oh, boy. Hey, Frankie. Welcome, welcome. You're number three today, girl. And let's see here. I am. Okay, I'm going to stop it there, and I need to turn my phone down so we are not interrupted. I put on Do Not Disturb. Okay, everyone. So welcome, welcome. So today I want to talk about healthcare and the standard of care. Has healthcare failed? And I started when I was posting the show on Sunday night. I said I put in here, why are nurses leaving the profession, and why has America gone outside to fill certain jobs? Um, why are professionals in healthcare quitting? But I guess it's not just nurses who are leaving the profession. You also have doctors, who are changing their their specialties. You have people who are not designated as a doctor or a nurse, but they may, have been the receptionist or someone who, could have been the housekeeping or the maintenance staff. A lot of people in healthcare who work in healthcare, around healthcare, they're leaving, and it seems abundant more so in America. So I'm just interested to know, why do you think that that's happening? Why do you think that in America? Hello, Green Sunrise. Welcome, welcome. Yes, all is well. Welcome. Green Sunrise is over on YouTube, so welcome. And I'm loving your videos, Green Sunrise. I am loving your videos. Um, so okay, so again, I just want to know, what is it? Is it just the fact that they're just worn out over COVID? Welcome back, Grit. So Grit, does this mean that you're technically number three? I'm just saying. So why is it, you know, I mean, are these healthcare professionals just worn out? Are, because you hear a lot of them saying that mentally, COVID has worn them out. People, they feel that people don't understand what they're doing and all the hard work that they put in. But why are healthcare workers leaving the profession? You know, um, And then again, when you look at and this is true for America. A lot of our nurses come from the Philippines and Taiwan. Welcome, DMAC. A lot of our nurses come from the Philippines and Taiwan. Why is it that we're not, that people in America are not, um, you know, going into healthcare? I mean, is it the pay? Is it the work? Can they not find a job when there are a lot of openings? I mean, what is it about healthcare here in America? Welcome, GP Matt. Hey, Grit. Okay, you're over there. Okay, and Green Sunrise says over on YouTube, they want to look after themselves more than others. Green Sunrise, do you think that's fair? Do you think that's a fair statement to make, that they want to look after themselves more than others? Because and again, I'm looking at a lot of stuff that's going over here in America, and I know you're in the UK. Um, because you have people who have just, especially during COVID, whether or not you believe COVID is real or not real, whatever. There were people who were putting in a lot of long hours at work and working double shifts. So this is where I'm saying, is it that they're just burned out? You know, um, and again, pre-COVID, you still have, again, for nurses, you have more nurses coming from out of the country, as opposed to, people in America not being, working in healthcare from, you have people in America who are not working in healthcare, as opposed to people from other countries coming to America to work in healthcare. So yeah, that's what I wanted to say. So, um, you know, why why is that? Okay, and lack of gratitude within the industry. Okay, and you're saying no. I'm asking, people's minds shift has changed somewhat. Okay, all right. Okay, so you're saying, so Green Sunrise, you're saying that people within the healthcare industry are not appreciating the people who work within the industry. So I guess the higher ups, are you saying, do not appreciate the doctors and nurses that are putting in the time? I just want to be clear as to what you're saying. Okay, guys. So welcome, Boss. So I am looking at two things here. I'm trying. Green Sunrise is over on YouTube chatting, and I want to make sure that I incorporate what he's saying, and also look at what's going on in the chat here. GP Man says, my respect goes to the workers in the service industry. Yes, absolutely, absolutely. But in healthcare, I mean, the standard of care has failed. I mean, unless you have, good insurance, and even then, if you if your insurance is good, that your standard of care may not be that great. So why has healthcare failed? Let's see. Okay, Green Sunrise says the reasons could be many, but what I'm saying is that maybe they are all just tired and want to look after themselves. Okay, got it. Um, yeah, I mean, yeah, and I think uh, that goes for a lot of healthcare workers. I know people who, are in the maintenance staff, at one particular hospital, and a lot of the maintenance crew have quit. Because they say it's long hours, that the pay isn't that great, and every time you turn around, they're supposed to do this, they're supposed to do that, and they're just worn out. They're constantly asked to work overtime when they've already, worked double shifts. So what do you do? And then Green Sunrise says, are there better jobs out there which give them more time with their families? And that's another thing that you're hearing, not just in healthcare, but across the board, that people do want to spend, more time with their families. Bob says no money, no money in the cure. He says socialism. Um, there's just so many reasons, uh, for why people are not staying in healthcare. And on one hand, it of course hurts the system, because you have people who are in the hospital, or who are, going to see the doctor, and who, would like to have a degree of, some standard of care, where they're, you know, getting something. Welcome, Petty Deb. But on the other hand, what do you say to all of these people who are, you know, either not making that much, or even if they are making lot of money, they're still working their asses off, but they feel like people do not appreciate the things that they're doing. You know, I mean, what about that guy that in Tulsa? What was that? 2 or 3 weeks ago, who went into the hospital and shot his doctor, and another nurse, because the doctor performed back surgery on him, and apparently it didn't help, or it didn't work. The man was, I guess, still in pain, so he comes back and he shoots his doctor. You know, um, was he told that he was going to be 100%, or did the doctor say, well, there's a chance that it's not going to work, and you just, didn't listen to that part? I mean, again, why has healthcare failed? Welcome, Woody. Okay, and let
Hey,
me wait. Hold on, Woody. Just one. I just want to read what Green Sunrise is saying over on YouTube. Excuse me. Green Sunrise says more restrictions set on healthcare workers, I think, and maybe that's why they want to try something else. And he also says, um, I think after COVID, it made us not just get lazy, but it made us look at taking more time for ourselves. Okay, I agree with those. Okay, Woody, I am sorry. You have the mic. Welcome.
it's all good. I just had one quick thing to say. Um, I was born with a disability, and uh, when I was a baby, the options were very limited. Basically, all they were doing at that point was amputating the leg. And my parents found a doctor who was doing a new procedure, and she'd gone to Russia actually to learn from the guy that invented it. And I was her first patient. So, needless to say, the first 15 years of my life involved a lot of surgery, and a lot of those surgeries didn't necessarily end well, and had complications and issues and pain and more crap than was expected. But I mean, I was just appreciative. We were just appreciative that there was somebody out there that was trying something different too, and willing to try and help. So, nothing's guaranteed in life, whether it's a back surgery or a getting rid of an ear infection with antibiotics. And I think people have come to have really unrealistic expectations of things. And this isn't magic. These people are doing their best. And I mean, it's a little different down there than it is in Canada. But she moved to Michigan, to the Children's Hospital in Detroit. And I spent from 5 to 10 years old in that hospital in and out there. So I've had a bit of experience with both systems, but it doesn't really matter. Doctors don't go through the schooling and do everything they do to become a doctor to make people worse. Doesn't matter who they are, unless they're Dr. Death, I guess.
So, do you think that people are, when they go to the doctor, that they're looking at this doctor to be God? That if you're going to operate on me or prescribe a pill, then that pill is supposed to be a magic pill, and how
A
dare I not
miracle.
get better?
Yeah, exactly.
Okay,
Yeah.
all right. Okay, hold on. Bob, hold on. I'm going to come to you. I just want to see if Green Sunrise or anyone else has anything else to say. Okay. All right. So, Bob, welcome. You have the mic. Are you up here? I guess he's not. Okay, hold on. I'm trying to catch it. Trying to catch it. I think. Hold on. Okay. So. Okay, there you are. Okay, welcome.
Hi.
I can barely hear you. You're very, very faint.
It's the same. It's the same as the other night. Is it? Can you hear me?
You're very, very faint. Very faint.
I'll log out. I'll get my phones.
Okay. Okay, so he is coming. He is coming back in. So, okay, so you know, I'm sorry, I'm just looking here. Okay, so again, what Woody said. You know, um, you know, are we expecting too much of our doctors? Do we want too much? You know, with the insurance that you have, you know, are you supposed to get this? Are you supposed to get that? Should there just be one system of healthcare? Because it seems like it works in other countries, but here people don't want it. And to me, I think a lot of the healthcare, of course, has to do with money. I don't care who it is. Everybody wants to line their pockets, or the higher ups, the lawmakers, the hospitals themselves. Everybody wants to line their pockets, and we the patients are left like, well, damn. So are we expecting too much? you know um if we ask that healthcare worker or that nurse to work a double shift, and she hasn't seen her kids in 2 days, is that fair? You know? So, Ba, are you back?
Yeah, I'm back.
Okay,
Is
there.
that
Okay,
better?
yes, 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 yes. Much, much better.
Okay. So here in the UK, we have socialized healthcare. We get taxed every week on our salaries, and that goes towards the National Health Service, which is socialized healthcare. Um, for a long time, we didn't have to pay for prescriptions. I know that, but sometimes you do if you earn over a certain amount. If you're going to pick up some medication, you might have to pay £7, which is maybe around $8 or $9. But I think this is definitely here in the UK. It's a huge problem. Everyone moans about it because you try phoning for a hospital appointment to see your doctor, and you're normally told, oh, you'll be 2 weeks unless you want a phone call. Now, a lot of people have started to push back on that and say, look, I want to see my doctor. And if you're persistent enough, you will end up getting one. Um, but the reasons why I think healthcare, the standard of healthcare has dropped is definitely here in the UK. This is the biggest argument against communism and socialism is when you're receiving the same amount for work. So doctors in the UK, I'm sure, make £70,000 a year. When you know you're getting that, regardless whether you do a good job or a bad job, it does breed. Like a lot of doctors are just doing the very minimum to get by. And there's also a saying here, if you want to see a doctor, go to the golf course, because that's where they all are. They're all hanging out in pubs and golf courses because they're getting paid regardless whether they do a good job or a bad job. And I remember back in the day, my great granny sat and told me how her doctor would come round and visit once a month or so and knock on the door and ask if she was okay, and if they would be invited into the house and be given a cup of tea or coffee and ask if there's anything that was needed. That's how much doctors cared. So I don't want to just beat on doctors, because there are good ones out there that really take extra, you know, curriculum, or they'll look into things for themselves, and they'll adapt, and they'll learn natural medicine, and they'll break free of the norm. They all go to school, they all read the same book, so every doctor is going to be pretty much the same. um but that is a huge problem here in the UK. So I don't know how you guys feel about, you guys have privatized healthcare, or you pay for your healthcare. Would you rather have what we have, or are you happy with that?
Well, for me personally, I'm kind of split because with the insurance that we have really good insurance. My copay is next to nothing, and uh, when we go in to see the doctor, I'm sorry, the copay to go in to see the doctor is next to nothing, and for our prescriptions, my prescriptions are $4. So I'm very happy with my health care. I mean, even when we were going through the whole in um, vitro thing, the whole thing only cost us $15. And I know that people are paying thousands upon thousands upon thousands. We were limited to 3 treatments, but it was only $15. So for me, am I happy with my health care? Yes. Am I happy with what other people have? No, because I think that it could be better. I think everyone should have a standard of care where, it's not expensive. They don't have to pay an arm and a leg. For some people, just for the copay alone to go in and see a doctor. Some people are paying, $50 to have a doctor, talk to them for 10 minutes, and that's it. I think that's horrible.
Yeah, I, I
So
think I,
what do
I
you
think
do?
as a rule, I don't like the premise of the more money you have, the better service you get, and that doesn't just go for hospitals. That's for anything. I even liken it to supermarkets here in the UK. There are a couple that are like top notch, like Marks and Spencers and Waitrose, and you go into those supermarkets and your veg is fresh and beautiful and ripe, and you go to the frozen section and it's top brands, but they're all more expensive, and that doesn't sit well with me. It's basically saying the more money you have, the better you can eat, and then obviously the longer you can live. I just don't like that system at all.
Okay, let me read what Green Sunrise says because I think he's talking to you. He says, "You got to remember they are working on a backlog of people from 2019. People stopped going or were not allowed to go because of COVID. So I'm I'm turned. They have a massive waiting list of people who wait. I think I'm assuming he's responding to you because Green Sunrise is also in the UK.
Yeah, yeah, I know that is the case, but I also know that that's been the case for a long, long time. Like I remember sitting in waiting rooms and being told, your appointment's at 2 o'clock, and you could be sitting there till 4 o'clock, or you phone up the doctor and ask for an appointment, and you get told, oh, your doctor isn't available until 2 weeks' time, unless you want a phone call or unless you want to see another doctor, and it's like, well, no, he's my doctor for a reason. But yeah, I know what Green Sunrise is saying. Obviously, with what's happened in the last couple of years, it's been a bit more hectic.
Okay, and uh, uh, welcome Crucible. Welcome Power Girl. I don't know if I said welcome to you. Welcome Power Girl, Crucible, and Alpha Mike. You know, with here in America, I don't know if it's necessarily how much you make. And when I say this, before everyone says, "Well, no, if you're poor," you know, but what I'm saying is, depending upon um, your job will offer you a particular type of health care. Like for my health care, like I said, I have great health care. It's because of where my husband works. So he happens to work at a place where the healthcare is exceptional. However, you can still work someplace where you're making a lot of money and your healthcare could be crap. So, you know, so again, that's where I struggle when you say, would you want to have, you know, just one healthcare system, or what do you have? Because it seems like, you know, over in France, it seems like that people appear to be happy, but at the same time, I don't want to have to wait 6 months to see a doctor and find out that I have cancer and it's in stage 4 and it could have been stage 1, you know, when I first called. So that's a concern. And I also want to make sure that when I go to the doctor, I like you said, Bob, I want to see my doctor. You know, she's my doctor for a reason. You know, I've had the same doctor for 20 years. You know, so and I know everyone doesn't have that. I know that it's, you know, for some people it's hit or miss. You know, today you're going to see Dr. Smith. The next time you come in, you're going to see Dr. Jones. Well, Dr. Smith told me that. Well, I'm Dr. Jones now. I'm telling you this. The next time you come in, you're saying, Dr. You know, Fred or whoever. I mean, I don't know. So
Can,
what do you
I
do?
can maybe elaborate on that. So I don't know if it's the same in America, but here in the UK, I mean, you hear people talking, and there are certain doctors that will just pawn you off with any old prescription. Um, I for one, have definitely had that, where it's, you know, I suffered with acne all through my teens, and every time I went to go see my doctor, it would just be, oh, here's some pills, here's some pills, here's some pills, and that obviously gets around, and then there becomes reputations where you'll hear like my grandparents talk about, oh, Dr. Strachan, he's really good, you should go and see him, and then people change over to him, and that is what I'm trying to say is, with the whole salary thing, when socialism gets into a certain uh, business, or you know, with the healthcare, or if it's police or whatever, when you know you're getting the same amount of money at the end of the day, whether you do a good job or a bad job, we all know there are people out there that will just take the money regardless, and they'll do as little as they can do to get by. And that's because there's nothing to work towards. If they knew the more patients that signed up for them, they get an extra £100 a month or whatever, they would try their hardest to be the best doctor that they can be. And even like you saying earlier about crap healthcare, depending on where you work. Why are we living in a world where there is such a thing as crap healthcare? I'm making a joke out of it, but you know what I mean. Like, when it comes to healthcare, it's the one thing that I think shouldn't be tier systems. It should be the best for all and the best that it can, and we should be investing in it, and making it the best it can be for all, regardless of what your status is.
No, I mean, and you know, I mean, that's true. You're right. Petty Deb says doctors are on salary, not on production. Government rips the medical um, community off. Money, that's all that matters. Let's see. Alpha Mike says America's healthcare costs 10 times more than it does overseas. DMAC is responding to Deb. Governments, by government, are you saying Medicare, Medicaid? Alpha Mike says doctors now can't perform life-threatening responses unless they are approved by a judge or lawyer, which is bullshit. And Alpha Mike, that's going to get even. That's going to get even worse. Alpha Mike also says, so if you're dying, they can't do anything without approval. You know, so unfortunately, people do have crap health care. not because they want it, but sometimes that's all they can. That's all they can have. Green Sunrise says, I cannot agree with this completely. I don't believe people are bad at their jobs. I just think that they're inundated by cases. Whether we talk about healthcare or I do believe it was GP Man who said that, the service industry, just the service industry alone, he says, my respect goes to workers in the service industry. Until COVID happened, to me, a lot of people in that industry were not seen. But now a lot of people in that industry, and not just in healthcare, they've kind of taken a stance where, because they're not going back to work, it has affected us. So what do we do to get over having to deal with crap? I mean, do you quit your job and go someplace else to work where they offer better health care? What if you work at a place where, if it's a ma and pop, place, they can't afford to buy the top tier, or, you're putting in so much and then they have to put in the rest. What if they can't afford it? What do you do? Why are people in Congress who are making all these rules about our health care? They have the best health care in the country for their entire family, but they're doling out this and that to everyone else. So what do you do? Do all healthcare workers just go on strike? Do all doctors say, well, I'm not going to perform another surgery? Do nurses say, I'm not going to come to work? Do the maintenance people say, well, all that stuff that's in that bin that's marked hazardous, we're just going to leave it there? We're not going to touch it? And it piles up and it piles up? I mean, what do you do? And again, I come back to my original question: why are nurses leaving? Healthcare? Why are they leaving? Are they just fed up? Are they inundated with work the way Green Sunrise said? So, Woody, do you want to pop in on that, or? Woody, I see that your mic is off. Did you want to?
Woody's not on the panel.
Oh, he's not. See, this is what I'm saying. I'm looking at one thing, and you all are looking at something else. Okay, thank you for telling me that. Well, welcome, Chill. Okay, Crucible.
Yeah, that's an interesting point that you make about nurses leaving the profession. I believe to a certain degree that's true. The statistics support that. But what's interesting about the nursing profession, I've known quite a few nurses. I've got two nieces. One is currently a nurse, been for 10 years. The other one is just enrolling in nursing school. And while it's true, particularly over the past couple of years with COVID and whatnot, there's been tremendous burnout. Obviously, for obvious reasons, I should say. But from what I can tell anecdotally, just talking to nurses and what I've read, there is certainly a high degree of burnout, but also what happens with nurses, which it kind of makes sense given the highly educational aspects of nursing, is upward mobility is almost impossible in nursing without a second or third degree. And a lot of nurses, just by the time they reach that point, maybe 10 to 12 to 15 years into their careers, they're starting to burn out on the nursing business, period. And even a promotion, going back to get an advanced degree, a lot of nurses I've talked to, by that point, they just don't have the will anymore to stay in the profession. What's interesting, though, however, I read something fairly recently from the Bureau of Labor Statistics, and they are forecasting from now until 2029, I believe, the nursing profession is forecasted to grow at 45%, which is far and away more than any other profession that they were tracking. And so I believe it continues to be an attractive profession because you've got women, mostly women, there's some men who have a great degree of compassion and empathy and they want to help people. It doesn't hurt that the money is extremely good. but it's a very self-limiting profession. So I think it's a double-edged sword. You make a good point. There are lots of nurses leaving the profession for pretty obvious reasons. What is interesting is the growth prospects for them. So there are still people interested in nursing. So I don't necessarily see the profession flattening out, but I think you're going to see constant churn for a lot of the reasons I just talked about.
Okay, I want to read what Alpha Mike says. Well, hold on, let me back up. Okay, Crucible, can you mute, please? Okay, Alpha Mike says, a pharmacist I work with in New Jersey, husband dies because the insurance company did. I'm sorry. I'm trying to read this. A pharmacist I work with in New Jersey. A pharmacist I work with in New Jersey's husband died because the insurance company, or you said, did not get him a double lung transplant. It was in the news. If you want to read, died because they did not give him a double. Oh, denied. Okay, denied. Okay, I'm sorry. You did a couple corrections there. Okay, a pharmacist I work with in New Jersey, husband died because the insurance company denied him a double lung transplant. Okay, and then Alpha Mike said, Magic Johnson was one of the first to get AIDS, and he's still alive. If you got money, you got the cure. Petty Deb says they are tired. COVID-19 made a lot of difference. Tired and low money. Alpha Mike says nurses get paid shit. D-Mac says nurses work very hard and take a lot of crap. They take crap from doctors, patients, and administration. Yes, they do. And nurses don't get paid that much. I mean, unless you've been working there for 100 years, you don't get paid much. But also, and Crucible, I said this before you came in. You also have a lot of nurses who are coming to America to work. Why are people in America not going into nursing? So that's a question. Welcome, Chill Will. Okay, let me read what Green Sunrise says first. He says, we will always see it from different points of view, but I also see a lot of good people in healthcare. I'm not sure if that's because I'm now working in social care in environments. I could be wrong, but okay. So, okay. Let's see. Chill. You have the mic.
You're not gonna say hello?
I said hello. I did say hello. I did. Welcome, Chill. How are you? How are you? I hope you're having a good day today.
Yeah.
I hope you're having a wonderful day. Now, what do you want to say?
It's awesome. It's awesome. It's absolutely awesome. How are you?
I am fine.
Oh goodness, this is horrible. What's up, y'all? Hey, everybody. Wild Crucible, my main man. Frankie, Alpha Mike, Petty Deb. If I'm missing somebody, what's happening? D-Mac. So the nursing profession. I don't know who told y'all nurses don't get paid, but I know I'm related, and I've dated several. So they get paid. Oh, especially during COVID, they get astronomically paid. They don't even need no lateral nothing. But now, what I can definitely say is that they all drink, they all be stressed out, they all take temporary assignments and then take a month off and then go back. But they get paid, like get paid. Um, and I make decent money, but if they take it, and plus they can travel, so it can be some benefits to being a nurse. I'm not, but to being there, having to deal with patients, resuscitate patients, especially with the temporary assignments. A lot of times they walk into a hospital, they don't know what the hell they're walking into. And so, for instance, I got a friend that's a nurse. Literally 2 days ago, I had to meet her out at a bar about situation she walked into, she had to leave because she was that upset, and it was a temporary assignment. So and so she said, I got to leave because it was just the care of the patients had been just null and void, and so so stressed out about these people, she had to leave. She couldn't even take care of them. She's like, I can't even fix it, and I'm about to cut somebody out. I'm about to just lose my contracts and my jobs, so I need to leave. That and they needed her, like they needed her at that moment, but she had to make sure she was there first, which you typically do before you help anybody else, and she went straight to the bar. But that does say a lot about the not, lot of nurses I know. My brother, I was just in the wedding this weekend. He's married to a nurse. Her sister's a nurse. They have a family full of nurses. Like, um, yeah, I almost married one, so they make money, but it's just not sometimes not worth it for them. The one I was just spoke about that went to the bar, she had a friend that's a nurse that quit because of just the pressure of, like you said, it was COVID and that, like, you know what I'm saying, stuff like that as well. They just got burnt out, and now you definitely can get burnt out because they make good money. It's just they don't, like, it. That's not worth it though. Like the what you got to go through and see and deal with the doctors. And I do that. I get listen when I go to the doctor, that's the worst because even the residents, they're like, I go to VA, and I mean I got a couple of doctors, but I go to VA. The residents, they're pompous. They're pricks at times. They think they know everything. They don't listen. And these are people's families and real lives that they're like, listen, you playing with these people's families and real lives. And for her, it was like it happened to be in a situation to where the majority of these patients were African American, and that's what really set her off. And so it was just like, man, this is I see this all the time. And so, she just had to take a step back, and she went to it drove her to drinking. So I can see how the professional people can get burnt out easy, easy. So yeah, I mean, I definitely think it's money in it, but how much money are you going to take to be that stressed out or see those situations? And I don't know. Some hospitals are different from others. Others are better than others, but for the most part, I mean, it's definitely, it can be lucrative, and you can go a lot of places. I know a lot of. I got one friend. She just doesn't stop leaving. She just came back from Hawaii for about um, a year and a half. Before that, she was in Maryland. Before that, she was in Michigan. Before that, she was in Florida. Um, and then she was in Cali before she went to Hawaii for like a 3 month stint. So she goes a lot of places. She gets her apartment's paid for. And so the money she's making is her money. She
No, I
ain't
mean,
got no
I know,
bills.
I understand that because I know a lot of traveling nurses. They do make money, but you have a lot of other nurses who don't make lot of money. So
Like if you got an RN, yeah, if you're an LPN, or you probably can be able to learn in. Even then, they still
right, this is what I'm saying.
paying,
So if you've been there
especially if you're working
for
on
a
a COVID
while,
situation. Yeah,
whatever. So I mean, because all
yeah.
nurses do not make bank. So um, oh, and by the
COVID brought
way,
a
Chill,
lot of
Green Sunrise
magic.
says hello to you from YouTube. So Petty Deb,
Oh, what up? What up?
my niece is traveling nurse. Everyone cannot travel. Bark says, what hypothetical do we have today? No hypothetical today, Bart. But maybe tomorrow. Maybe tomorrow. Okay. Let's see. Petty Dep says nurses in Arizona hospitals start about 45 a year. That ain't crap. Private facilities normally pay more. Okay, so Ba, you want to pop in on what Chill said, or what you and Green Sunrise are having your little bromance over there on YouTube?
Oh no.
So obviously I'll just speak for the UK. If I think the nurses, I don't really mind that being like a tier system thing, because I know there are some nurses that are receiving minimum wage, and correct me if I'm wrong. Maybe Green Sunrise over on YouTube can elaborate, but there are some nurses that jump in their cars and go visiting homes to homes, and they'll make the patient a cup of tea and make sure that they've taken their medicines, and they do that all day. and then there are some that will stay overnight, and then there are some that are based at the hospital. But in regards to like the pay grade, obviously they have something to work towards. They maybe start out on minimum wage, and then they'll learn about the medicines and they can administer the medicines. Then they'll get a bit more money. So that is a thing here as well. And just to make a little joke about it, here in the UK during COVID, our government thought it would be a good thing to clap at 8 o'clock for like 5 minutes for all the good work that the nurses and doctors had been doing during the pandemic. And we were all screaming that we should be paying them more. A clap's not going to help them at the end of the day. So everyone was like opening their windows at 8 o'clock on a Monday night and clapping for 5 minutes. That's how cheap our government is, and that's why you're seeing that. You and Crucible were talking a little bit earlier about a lot of nurses are leaving the field, and it's not only that here in the UK, they are doing that here as well, but also there's no interest from school leavers, from 15, 16, 17-year-olds to go into that field because it's so poorly paid. And that's a huge problem. The government need to go to schools and colleges and universities and offer some form of incentive to go into that field, because we are lacking. And another thing, just to finish off, is what we have here in the UK is, because of shortages with doctors and nurses, instead of doing what I've just said, what they'll do is we've had a thing here where they reach out to countries like Nigeria and African nations and steal their doctors, and they'll come over, they'll fly them over, put them up in a 5-star hotel and pay them really good wages, and for maybe a week or two while a doctor's on holiday. And that just shows, I mean, there's nothing against the doctors that are doing that, because that's good, but why aren't we investing in our youth and making it a good thing, making it a good you know career, making it a good career path.
Well, well, hold on. Let me read this first. Uh, Alpha Mike says, I don't want, okay. Crucible, okay, you're back. Okay, I don't trust some of those at home caregivers. A lot of them steal or treat their clients bad. I know from experience with dating one. I'll take care of myself. Thanks. And then Alpha Mike says, or Deb, you were replying to Alpha Mike about Magic Johnson. He was HIV positive, not full blown AIDS, and that will take less. Okay. Okay. So you're saying. Okay, so you're saying that Magic Johnson was or is, I'm assuming, HIV positive, not full blown AIDS. Okay, so and Petty Deb says that nurses from out of countries will accept less money than U.S. doctors. So why do you think, Ba, that you have people from other countries, from Thailand and like I said, we get a lot of our nurses from Thailand and the Philippines? Why do you think, if doctors are coming from Africa or whatever, are they coming to the UK because there's more money in the UK being offered than they're getting in Africa? And the same thing for Thailand and some of these other, places that go to the UK or go to America to work. Is it because they're getting more money?
I think it's my understanding that they're being approached by the government or the hospital. I don't think they are coming over and seeking work, which is wrong on both parts, because you must think of the countries that they're leaving. They're probably short staffed now because their doctors are leaving to go to America and the UK. So it's going to cause a problem in their countries as well.
But I'm saying, are they leaving because of the? I mean, why are they leaving? Why do you think they're leaving? Do you think they're leaving because of the money or because there's more opportunity?
Yeah, both of those things.
Okay. All right. Crucible.
Yeah, I think you guys make good points. If you look at a lot of immigrants, pick a country, they're coming from ostensibly poorer conditions than they're going to find here in the United States. Sometimes it doesn't work out that way, but that's generally the outcome. And so you've got people who come over here from Africa or from China or places like that, and they'll take a job driving a cab, which a lot of Americans would look down on. But that could be a not prestigious, but that could be a status job, at least a status salary in the countries that these people are from. So it's kind of that old, a lot of these immigrants will take jobs that Americans won't. So there's that whole land of opportunity thing. But the other thing that I've read about reasons why nurses leave the profession, and this is endemic to just about all industries, and that's upper management. And what's ironic about upper management in the nursing business is the majority of people working in management came up through the ranks. They were nurses themselves at one point, so they know the conditions, they know the stress, they know. I think Chill made a reference to, and he's right. A lot of the nurses that I've known do kind of hit the bottle a little bit, but management does not seem to be, and it's very similar to other first responder situations. Things I read about the police department here, the fire department, they just don't seem to be sensitized to the conditions and the stress. And I don't know what the solution is. I don't work in that business, so I'm not going to say, well, have a happy hour every Friday. That's not going to get it done. But maybe regular meetings where you talk to these people and listen to their concerns and their grievances and their stress. Because if you don't think your management is listening to you in such a stressful job, it's one thing if you have a sales job and you hate your boss or something. It's not the end of the world. You're not under a bunch of stress. You're not watching people die every day. You're not trying to save lives. So that position is got a unique combination of stress and extreme pressure in terms of what they face every day. And from what I understand, curiously, the management at a lot of these hospitals just don't seem to give a damn. It's like once they're out of that environment, it's somebody else's problem. So I know that you can say that a lot of industries, but I think it's a little bit different when it comes to nursing. If you don't believe your upper management gives a crap about your day-to-day existence, you aren't going to stay.
Okay, I want to read.
I want to add one more thing real quick, Sal. But the thing that's very frustrating for nurses is, and I've read this a few times, is because of the highly specialized nature of what they do, they really are kind of locked in. Because once you've been a nurse for 15 or 20 years, you either continue as a nurse, go back to school to get another degree so you can take a different job in the nursing business, or you have to leave and you don't have a skill set necessarily to take to another industry, and here you are in your 40s. So I think that's a lot of frustration on the part of nurses because they are pigeonholed into a specific set of skills. As attractive and as admirable as they are, they just don't translate very well, and I think nurses feel trapped.
Okay. I'm going to go back over to YouTube. Green Sunrise, you have me over here just smiling to myself. But I'm glad it wasn't too bad in terms of what you had. He also says, here's the thing. Maybe people from other countries are just better at their job than us lazy UK workers. And you also say, have an outstanding night, all of you guys, and massive love, Green Sunrise Podcast. Yeah, you guys need to give him a follow on Podbean and on TikTok. Love yourself before anyone else. So if you are leaving us, Green Sunrise, thank you for coming. I do appreciate it. Okay, so all right, so not many want to. Okay, DMAC says, or I'm sorry, Paydep says, DMAC, I'm sorry, says more money and more opportunities outside home country. Deb says Saudi Arabia pays crazy money to nurses from the U.S. And DMAC says, when not many want to work in Saudi Arabia, I don't think I would want to work in Saudi Arabia. And DMAC says, crucible that upper management is a squeeze. They have profit pressure. And it's a shame because the healthcare industry over over time, I'm not going to say 5 years, 10 years, whatever, but just over time has become a business like everyone else. Before you go to the hospital, doctors would make house calls. I mean, I remember when I was younger, my doctor used to come to the house But over time, healthcare also has become a business. How many beds can we squeeze into this ER? Let's move this part out, and we're going to squeeze two more beds in. Before, if you had a baby, you were in the hospital for a week. Now it's like, okay, less than 24 hours, they're telling you to go home. And that's with a lot of things. You have surgery, and 48 hours later, you're home, but you spend a lot of time traveling back and forth to see the doctor, that maybe if I had just stayed in the hospital a little bit longer, I don't have to go back and forth to the doctor. So, and everything is profit driven. So, is our healthcare going to continue to fail? Does America adopt a healthcare system like the UK? Um, I think Canada, I'm not sure. Woody, are you from Canada? He's not on the panel. I keep seeing him on my panel. Does Canada have the same healthcare system as the UK? Is it like one system for the most part? So, but anyway, chill. You want to add any input?
Um, well, on the Magic Johnson thing, I think he's reversed his whole. He doesn't even have any traces of HIV anymore. I mean, but it's the same medicine. He's gonna say it's the same medicine as everybody else gets. You just gotta take it and stay active. I mean, he getting fat, so he good. You right. But overall, like if you really wanted to search for a remedy for any kind of cancer or disease, it's typically a homeopathic remedy out there. It's a disciplined lifestyle that you got to live, and I think that's most for anything. Like if you can do that, like whatever cancer, if you can live that disciplined lifestyle, you can extend your life years upon years without even having to take certain medicines.
But do
And that
you
because that's been out there.
but do you think that even though Magic was HIV positive, do you think that he, because of his wealth, that he
I
had
mean, he has
access?
opportunity to exercise, eat better. Yeah, I mean, but it's not. I
Well, I'm
don't think
not
it's
even
different
talking about
medicine.
the exercise and eating better. I'm saying, is the money? I mean, does he have the money to maybe get those pills that he needs to take? Once a day. Whereas if someone else was, sick or
I mean, it's the same. No, I
positive,
mean, everybody can have a health care. I mean, I don't. I mean, yeah. I mean, I
well, yeah,
guess
but everybody's healthcare
I
is
think it's
is not the same.
right, but I think it's still available. It may be necessary. Not like they're not gonna give you that. I mean, because you don't can't afford it. Like, I don't think that type of medicine is. Even if you can, they're not gonna tell you. Maybe you go in debt, right?
Right. I
So
mean,
then,
but
I mean,
okay,
they
but I'm
typically
just saying,
give
but
out
but
that kind of
damn, why do
medicine.
I have to go in debt to take a pill where, unfortunately, yes, he's worth
Listen, hey, listen.
millions.
Beggars can't be choosers. I'm trying to live as long as I can. You're right. I mean, that may be the unfair part. But that's another thing probably too. Stress is out of anything, stress is the number one killer of everything. Whether it's cancer, whether that's what causes it, like stress can, and when I mean stress, I mean like unknown stresses. You have stresses when you don't sleep enough. Your body's under stress. You may not feel it, but like there's certain stresses you may have. So that kills. That's the number one killer of anything. So if you being less stressed can give you a prolonged life, right? So, um, I'm just saying that I don't think he has necessarily different medicine, but he has definitely a different lifestyle. So
I mean, no, but I
that
mean,
that
but
helps a
no,
lot.
but again, when you say beggars can't be choosers, I mean, come on, chill. I mean, when you look at the healthcare that the people sitting on Capitol Hill have, they have the best
Hmm.
healthcare in the country. In the country. Yet you have people who
Yeah.
who are HIV, whether they have full blown AIDS or even if they just have a freaking cold. Some people cannot
Hmm.
even afford to go and get Tylenol. There, that's a
Right. But
that's a problem. So I'm so
what,
it's okay. Well, I'm not going to say it's okay, but why do I have to go into debt and possibly not eat because my kid, needs, uh, cough syrup, as
I
opposed
mean, hell,
to
they can
some
run
of
for
these
office.
people sitting on, you know, these senators and these representatives who,
Hmm.
they they can get anything. I mean, that isn't fair. But yet they're but
Life
yet
ain't
but
fair
yet
in that
they're the
regard.
ones who are either stopping it, or giving us, giving out little tidbits, whatever. So
Hmm.
shouldn't we have a system where everything's fair, but at the same time, I don't want to have to wait, like I said, 6 months to see a doctor.
What is this mythological, mystical system that you plan to put in place for that to happen?
Well, I mean, is it? Is it? I mean, because people have been talking about universal health care for years. But is there a
Okay,
way to
so
get universal health care where it's fair for everyone? I mean, is is
I
is
got
there a way? Do the people who are senators, maybe, why don't you all give up some of the healthcare benefits and all the money that you're putting into your healthcare and spread it around to the states that you work for? Maybe we can do that.
that's not how healthcare system works. I mean, they still probably pay into whatever plan they get. I mean, they get a
No, but I
premium,
mean, but I'm
right? It's
just saying. But
premium, but
okay,
they
so paying in, I'm saying, so should they pay in with some of their for some of their salaries? I mean, I'm just saying that for
well, I
some
guess I
people.
got you what you're saying, but what I'm saying is that it's still, if I'm making 100, 120, $200,000 a year in some cases, what the politicians make, um, I'm probably able to afford, just because of my job, my healthcare plan is probably going to be premium. I mean, I got a decent job that has a good healthcare plan if I was to pay for it. Then a plan if I was to pay for it. So I mean, I think most people who make over $100,000 or more can probably afford decent healthcare. I don't think it's just because they own Capitol Hill. It's just they got a good ass job that pay decent money, so they,
No,
uh,
Capitol Hill, they
like
they
everybody
have
else.
they have the best health care in
I
the
mean,
nation. But
I don't know about that. Do they? Do that? Because I don't know. I don't even know how much. I don't think much. I think that's a really oxymoron because it's just. I don't think that's even possible. Western medicine and the best healthcare. That's like sounds like a oxymoron. We got the sickest people in the world over here, so that's not.
because nobody
Yeah,
can afford health care.
no, but it's not even about affording it. Whether you can afford it or not, they still people still getting sick, and I mean, I don't know. It's a. I don't think it's. My point is that you still have options. You can. There's. Believe me, like if you want to that right now to be able to be, healthy. There's several ways to be healthy, and you could just research it. It is. I mean, it's several ways. If you want to be healthy, you got to be disciplined. And even when you have it, you still got to go to the doctor. You still got to maintain. You know what I'm saying? Sometimes they're not even right. I just went to the doctor for 10 years. I was on a CPAP machine, and I found out it was freaking acid reflux. And so this is not even a joke. But regardless of whatever, it was a combination of both what they were saying. But what kept waking me up at night, I thought was acid reflux. But I mean, my sleep apnea was acid reflux.
uh,
So it's still not the perfect. It's just not perfect.
I will
And you got to
I
take care of yourself.
I will tell you what it was. You had gas. So
Well, right. Yeah, that's the reason I had. But the one thing you did mention it was the other countries. The doctor, I'm a little bit familiar with that because I was pre-med for a while, and that's one thing that they mentioned. That's one reason that they told me to go into it because especially me being a minority, a great opportunity, and be a doctor. But the road to be who wants to be a doctor in America? It's not a sexy thing. First of all, if you get into it, the insurance like is ridiculous. To have your own practice is ridiculous because you can get a suit from up under you, and you got to go just to do what you want to do. Sometimes, in some cases, you got to do 12 years of going to school. Who wants to do that in this microwavable world? Like these young kids don't want to do that just to get paid and have astronomical debt. It's not a sexy job, so they go over there where engineering or to other countries, India, Africa, where it's sexy to be that. They still is a thing and it's a shortage here, so it makes sense to go over there and get the doctors. That's not, I mean, because we need them here. I don't know nothing about the countries where it leaving them a shortage because everybody wants it to be that. Like if you, the African people I know, like they literally smart as fuck, and everybody's like that's a really a big thing. Like it has one engineer, a doctor, or something like that, scientist in the group. So it may be a plethora of them. Who knows? Either way, I don't know about their. I mean, they may be messed up anyway. So it's not like I have no idea. But I know getting them from other countries is not a bad thing. You always want to try to cultivate it over here. But you can't make people want to be doctors. You can't make. I mean, I think they do. I had a whole science program where they especially minority doctors, they was paying your tuition to go straight through. And people still didn't elect to go into the sciences because it's not a sexy field.
So, um, hold on, I'm pushing buttons here. Um, Wait, hold on, I did something. Okay, DMAX says, but you were able to go. Many people can't go, and uh, referring to you, Chill. Some people, and Deb says some people cannot afford medical insurance. Juju says papaya enzymes best thing for acid reflux, sold in the health food stores. And some people, and Petty Debt says some people can't afford rent. So, you know, once again, it's like everybody cannot afford to go to the doctor. But Bob, I want to address something that you said is while the hospitals are reaching out to these other countries to come, maybe hospitals should reach out and go to high schools, or something, to go to some of these kids who are, about to get out of school and say, hey, you know, the healthcare industry is this or this and this and this. If you do this, then, and if you come to our hospital, whatever, then we'll give you this or something. Maybe that's something that they should do. Reach out, to the younger kids to get them motivated or want to go. So, Bob, what do you think about that?
Yeah, I already said that. I said the government needs to reach out to
No, I'm
schools
no,
and
I'm not talking about.
universities.
Oh, okay. Yours is government run. Okay, I'm sorry. Yours is government run. I'm sorry. I'm thinking because ours is it isn't.
Yeah,
Okay, okay.
but
All
they
right.
need to reach out to 15, 16, 17-year-olds and invest in that age group and say, come and work for us and we'll give an incentive to do it. And instead of having to do that, because it's not that I'm hating on immigrants. It's because it's also a problem in their country. When we take their best doctors, then those countries are clearly going to suffer. um, but I'd like to touch upon the Western medicine is also a problem, a huge problem, and I already mentioned at the start of the show that there's no money in the cure. And I know the big topic is like the one that everyone's touched on is cancer, whether there's a cure or not, or whether they want to cure it or not, because one, there's no money in the cure, but also two, they need people to die. And I mean, that's been, many people have said that to me over the years. But I'd like to say a lot of people need to start looking at their own health and preventative care. Um, the basic American diet and UK diet, even, with McDonald's and fast food and all that, is a huge issue. And my wife works in an apothecary, and she's worked there for about 3 years now. And the things that she learns and teaches me about, dandelion and all these herbs that can do wonders, that's the kind of stuff that people should be on board with. And I know if your leg's hanging off, the dandelion's not going to help. But in regards to long term, taking vitamins and all these minerals and things that we should be taking daily is much better than going to your doctor and being prescribed a drug for the symptom. It's not going to cure you. What they're doing is they're giving you medicine to fix the symptoms, not fix the problem. And it's not that I'm hating on doctors again, because what you've got to remember is these doctors are going to government schools and universities and learning from the same books. So they're all the same standard. And it's the ones that do look into it for themselves. Once they become a doctor, the ones that read up on alternative medicine are the ones that you should be, going to. And that'll be the ones that you'll hear people talking about, oh, he's really good and she's really good. You should change and make him your doctor or her your doctor. Those are the ones that end up excelling.
Okay. Green Sunrise is back, and he says, no, you cannot invest in 16, 17-year-olds as their heart is not in it. And he says the reason people become healthcare workers is because their heart is in it. So, Body, you want to respond to Sunrise?
He's such a pessimist. No, but I mean, if they offer £10 an hour to, or maybe a bit more, to a 15, 16-year-old, they'll take it. I know it's not a good thing to offer money, and it should be in the heart to want to do that job, because it's a very stressful and caring and empathetic job. But that would come. We need to do something, because the state of the healthcare system here in the UK is abysmal. And just to add to Crucible's comment about people leaving, that's definitely the case, especially in the last 2 years. I can only assume, because I don't know the facts, but I can almost guarantee that some of the 60-year-olds and up over the last couple of years have decided to retire early because of what's gone on. And also the young people have maybe been scared away from the field because of what's happened in the last 2 years with the pile up and obviously the COVID stuff. So there needs to be something done. And I think giving an incentive to 16, 17-year-olds to go into that field and make them, see the benefits of it, would be a good place to start.
Okay. Deb says standards are not the same worldwide. Juju, you're asking Bob where his wife works, and that's a personal question to put out there. So if he wants to kind of give you an
No,
idea,
I, ju-
Bob.
I just saw that just now.
Okay.
Sorry, Gigi, I was
Okay.
typing, but no, she works in an apothecary here in
Okay.
Glasgow. It's just a. Oh, I'll message Juju. I'll tell her.
Okay. Okay. Yeah. So sometimes we don't get too personal. Um, okay. So let me see if Green Sunrise. Okay, he did respond. I know my girls earn more money in a cafe than she would in healthcare, more than $10 an hour. So, Vi, you want to respond to that? Okay, I think Vi's jumping over onto YouTube. So, Chill, are you still with us?
Sorry, were you talking? Oh,
I'm here.
Okay, okay, Chill, go ahead, Chill. Vi, I'll come back to you. Chill.
Yeah, I mean, like I said, as far as reference to like I had a, like I said, I was in school, maybe that was 20 years ago, and they were still having this problem. And well, not 20, maybe 10, but like they had a whole science program dedicated to, was free. I mean, if you had the grades, you can go into the
Chill, you are
it was
breaking up. You're breaking up.
let me try to. Why?
You're breaking up.
Can you hear me now?
I can hear you now, but you're
One, two, three, four, five.
okay. That is
One, two,
better.
three. Okay. All right. So yeah, I was what I was referencing. I think they've been trying to incentivize that field for a long time. They definitely incentivize the nursing field. And with the doctors, I'm for sure they do, because I was in the program that did, and they would try to streamline eye doctors, dentists, like the foot doctors, things of that nature. They try to streamline them to like a 6 year after the it was an actual JUCO school, which is a really good JUCO. It was a really good JUCO school that you can actually kind of jump right into a 4 year program and after that school and go straight to being a doctor, a foot doctor, eye doctor, and then you can do a regular doctor. It's just you have to go through the 8 years, but it's been incentivized, and for, especially for science students and minorities, like women, minorities. It was everything in reference to that, and so it's been there. Those are programs have been there. It just I don't think, like I said, the young kids have the wherewithal or just want to be like it's not a sexy job. Like overseas, they're sexy. Like it's a big thing. Like how it is to be a football player or NBA player. That's how it is in India or Africa. And some of those other nations. It's cool that hey, I want to be smart and successful for my family. It's not like that here. It's just they can care less. Like if people, nobody want to be no damn doctor.
Okay, I want to respond to what DMAC said to Ba. He says the UK has the US common person fooled. Many people in the US think the UK system is great because everyone is covered. So, Crucible, do you want to add anything? Because I'm going to be wrapping it up pretty soon. Crucible?
Yeah, I think I don't think there's anything wrong with offering incentives. Like Jill said, they've been doing it in the medical profession for a long time. But I don't necessarily think money at some point, because I do think on balance nurses are compensated fairly well. So I don't know that the incentive needs to be so much on the front end when you got an 18 or 19-year-old kid who may be trying to make up his or her mind about what they want to do. Like I said, there are a lot of people joining. They forecast the industry to grow almost 50% in the next 10 years. Maybe the money would be better spent on retention bonuses, trying to keep people who have been there for 10 or 15 years who are burnt out. But at some point, money's not going to keep them either. I know it's probably a pipe dream, but in these people are under tons of stress. But if you could create a culture in some of these hospitals whereby, maybe you conduct regular meetings, you give surprise days off. I know that has to do with staffing and whatnot. You can't just do these things willy-nilly by the seat of your pants, but I think it's a quality of life thing for nurses and medical professions. At some point, another $5,000 to stay for 3 more years isn't going to get it done when I go home at night and I have to drink myself to sleep and I'm fighting with my wife or husband. It's not going to cut it. But just to jump ahead real quick, I'll make a real quick comment. And this is not a political statement, but I read something recently, and it's on both sides. So this is not a left or right thing, but the money that big pharma and big healthcare spends lobbying the government each year is in the hundreds of millions of dollars. They are getting something for that money. I think DMAC made an excellent point, and you guys have picked up on it since then. The hospitals are in business to make money, period. I don't begrudge them that. We can't have businesses who are not for profit. That's just not the American way. I'm not begrudging them making money, but something is going on here, whether it's the pharmaceuticals, whether it's the bandages that you get. I mean, there's something going on with the money that big pharma and big healthcare is spending with the government. They're expecting a return on that money, and they're getting it. So I don't know what the answer is. I don't think you should overregulate the medical field, the healthcare field, but there's too much money from that business in politics. And until that starts to get regulated a little bit or mitigated a little bit, there's no incentive for these people to do anything but squeeze, like DMAC said, squeeze every last nickel out to the detriment of the patient.
Okay, then. That was a mouthful. I'm going to start wrapping it up. I will start with Crucible. Do you have anything else you want to add?
No, I think it's a travesty, and I know we all are probably on the same page there, that here we are in 2022 having this level of conversation about the poor quality of healthcare in our country. We seem to be chasing our tail. I thought we had made a breakthrough with Obamacare 10 years or so ago. I think it was a step in the right direction, but something that as we age as a population, particularly more so than we ever have in the history of our country, we're going to be putting more and more stress on the healthcare business, and more people are going to be suffering needlessly. So something that affects so many people in such a profound way that we're still struggling with it in 2022 is just, it makes me sad. Until we prioritize it, nothing is going to get fixed. I know that's a very grim, prognosis, but we've been at this so long. Something's got to give, and so far it hasn't.
Okay. DMAC says money is available for most STEM careers. Kids don't like science and math because they are difficult subjects. And I will say this, DMAC, where I live, the high school that is in my city is the largest high school in Southern California, and it's probably one of the most advanced high schools on a technical level in the entire country. The amount of money that they spent building just a building for STEM and the things that those kids have access to is like phenomenal. You would think that they were going into NASA. So a lot of money is now, you're absolutely right, is, there for STEM. And I hear that across the country, and I can only speak for here in America, that STEM, that a lot of money is being put into a lot of those schools. Juju says Walgreens offers an incentive with $1,000 bonus to work behind the counters. I heard about that. I heard about that. Bob says look up the meaning of the word pharma or pharmacy, or is etymology. Senators. Petty Depp. No political calling out on this show. Not like that. Not like that. That is a warning. Okay, so chill. Any last words?
I don't see Chill on the panel.
I see. Thank you for telling me, because he's on my panel. Okay, Bob, you have any last words?
Well, I'm actually going to steal one of your phrases, individual responsibility.
Oh, wow.
So-
You're actually using that. Wow.
So I'm saying,
Oh.
in my opinion, I think we all need to have more individual responsibility when it comes to our health and not rely on a broken system and Western medicine. I think it's even down to things like watch what you're eating, do exercise. And I know that that's for like the long term, for getting any like illnesses when you're older, but that's the least we should be doing anyway. And then, yeah, I've thoroughly enjoyed this episode. It's a topic that I would have liked to have covered on my show anyway, and maybe even on Friendly Differences, because I think we all agree that the standard of healthcare in all countries, I believe, is declining. So thanks for having me on and letting me share my opinion.
Okay. All right. Well, thank you for coming on. And Saturday Night Smoke, thank you. But we are about to wrap it up here. And also, Green Sunrise is over on. He is over on on YouTube, and he has a good podcast. So not only do you guys need to follow him on Podbean, but please follow him on TikTok. He is trying to get to his 1,000 followers so he can do live shows. Yeah, also because y'all follow us on Friendly Differences too, so we can get so we can do our live shows. But yeah, so you all can follow Green Sunrise Podcast. His TikToks are funny, they are informative, and he's a nice guy. So if you guys can follow him, that would be great. So for everyone else, I'm sorry this is a short show, but this is where I'm ending it. Tomorrow, we are going to have hopefully a fun show. I try to have fun shows, but they don't always go that way. So, tomorrow's supposed to be a fun show. And Chill Will is going to be hosting a show probably sometime next week. So, that's it. So, everyone, again, thank you so much for coming. And go where the wind takes you. Bye. Thank you, Saturday Night Smoke, Juju, Crazy Town. Thank you, Power Girl, Bod, D-Mac, Frankie. Grit was here. And he was also on Podbean, Green Sunrise. Thank you for popping in. Woody Bush. Did I miss anybody? D-Mac. Thank you. GP Man, Cuddy Deb. So thank you all. And Angie was here earlier. Bart was here. And Alpha Mike. So everyone, thank you. Thank you so much. And again, Green Sunrise, thank you.